Hi, I'm Jon Stine, Executive Director of the Open Voice Network, and I'm speaking to you from Portland, Oregon in the States. Our topic today is voice technology, the ability of humans to speak to computers and for computers to speak back. This is a growing wave of technology innovation that is increasingly important to the health, wellness, and life sciences community. And so we raise the question today, can you hear it coming? The value of voice technology in health, wellness, and life sciences. Again, I'm the executive director of what's known as the Open Voice Network, and we're part of the Linux Foundation, an open source community of the global and well-respected Linux Foundation. We're dedicated, and our job is to think about technology standards for such things as interoperability and privacy and data security, as well as usage guidelines for ethical use, usage guidelines in industries such as health, wellness, and life sciences. And it's all about helping shape this emerging world of voice assistants. We're a global organization, more than 220 active monthly volunteers, many more of that than that who participate with us on an ongoing basis, and with representatives and participation from 13 nations, strong representation in the EU. I've been in technology more than 20 years with the Intel Corporation in the States, Cisco Systems, you may recognize those brands. Went back to Intel for a few years and found myself having a cup of coffee with some friends at the Massachusetts Institute of Technology in Boston. This is back in 2016. And we were talking about the technologies of the day, things like AR and VR and IoT and blockchain, and all that was going to reshape the world, as we thought, and ask ourselves, and the question was posed around the table, what technology will most reshape the relationship between a patient and a provider, between a brand and a consumer? And before we left the coffee table, we had agreed it would be voice, the ability for a human to speak to a computer, for a computer to speak back, for a patient to be heard, and a patient to share. And to do that in an automated, accurate way. This was a life-changing, industry-shaping technology. Let's explore it. And from that came the Open Voice Network. So let's talk about why this is important, just in general, about voice technology. And then we'll get into why in the health, wellness, and life sciences industries. Just why now? What's about voice that is so important? Well, we've been living from a technology interface, that is how we send in data, how we share data, how we input data. We've been using 19th century technology for about, well, gosh, nearly 200 years. We'll be living in the QWERTY, QWERTY world. You see it on typewriters, you see it on smartphones and keyboards on your laptops. You type, or you tap, or you swipe, and that's how we enter data. That's how we communicate with machines. Really hasn't improved since the 1840s in typewriters. Now, generally, on average, most people can enter data and type at 40 words per minute. Not that fast. And truth be told, those keys or those surfaces or those screens, they get rather grimy and dirty, which may not have been a big deal in the 19th century, but in a pandemic world becomes increasingly important. Now, what about voice? Just for data entry alone, just think about what the 21st century technology can do. It's highly accurate, recognizes dozens of languages. It's artificial intelligence, natural language understanding, and then speaking back to you, natural language generation. You can input data at the average speed of speaking, which is 130 words per minute. Just do the math and think of the efficiencies in a clinician's office. in a hospital. Just think of the efficiencies, that alone. It's also hygienic, it's hands-free. You may be close to a microphone, you may be holding a microphone as shown here in the photo, but you're not typing, you're not tapping, and that counts for something, again, in today's world. But that's just the start of understanding what voice can do and what voice technologies can be. Again, artificial intelligence, natural language understanding, natural language generation. You speak to a machine or a computer, it speaks back to you. Now, this is going to be, and currently is, this technology in all sorts of devices. Many people just equate voice assistant with a smart speaker, something like from Amazon or Google or Deutsche Telekom Magenta. But voice technology will be in nearly every digital device. It'll be the interface to the digital world where every device is digital. So in your smartphone, in your hearables, your earbuds, it'll be through your laptop and websites, part of your smart home. Turn on the lights, open the curtains, close the garage door, all with your voice. It'll be in appliances. You'll turn things on and off, set the temperature on your oven, tell it how long to bake. It'll be part of your autonomous vehicle. And currently you'll be speaking for directions. You'll be speaking for information about where's the closest petrol station, where's the nearest charging station. You won't need a remote control for your entertainment. You'll speak to your smart television, your smart devices. Choose the network, choose the streaming service, choose the program, or choose to deviate and go someplace else. It'll be part of the immersive world of gaming. The metaverse will be voice driven. The immersive world of the metaverse will be voice driven. It's already moving that way, and especially in the experiential games favored by women. And then, of course, it'll be part of the smart speaker world. It's the core of smart speakers. Voice, again, this is the interface, the 21st century interface to the digital world, not just one device, but to all devices, and all devices in an era where all devices are digital. Let's continue to think about this. There was a study, there's a great firm in London called Vixen Labs, and they have been leading, Open Voice Network contributes to this, they've been leading a study of consumer behavior with voice. Germany, US, UK. How are people using voice? Interesting, because this study is pointing out what we have suspected for the past 18 months. The use of voice assistance is normative, is normal, is part of everyday life. More than half of German adults were using voice assistants regularly in 2021. This data stems from the first quarter of 2021. And nearly a third, 31%, used voice assistants daily. Part of their life, part of every day going through daily life, using voice assistants. Now, and they weren't just kind of listening to music, because, you know, when you ask the question, what do you do with it? 37% of German adults were using voice assistants to search for information. They search for products and services, more than 1 out of 5. They are searching the digital world, voice as their interface. And this is becoming normative. So the question for all of us here in this room is, they're probably searching for you. They might be searching about your products and your services, your hours of operation, what you provide, your specialties, who's on your staff. Can you hear them? Can they find you? But that's not just all that voice provides. Voice speaks, natural language understanding from the human to the computer, and natural language generation from the computer back to the human. And most of us think about the speaking part of voice, no surprise. But voice also offers a tremendous opportunity to listen. And in fact, when we think about voice as really just a subset of conversational artificial intelligence, conversations about speaking and listening. You have to listen in order to know what to say next. A good conversation involves an awful lot of listening. And the tremendous thing about voice technology is that it offers providers, clinicians, those who care for patients and plan treatment, a tremendous opportunity to listen. Now, the listening starts with biometric identification to some 98%. Voice is a biometric identifier, and in that way needs to be treated very carefully. GDPR guidelines and regulations come into play here. It's a biometric identifier. You can identify your stakeholders, your patients, with a high degree of accuracy from their voice. But it also not only can tell you the words that are said, but also give you a sense of how those words are said. When you listen, you hear not only the words, but you hear the volume with which I speak, or whether I'm sad, or whether I'm angry, or whether I'm very excited about all the great things that are happening. Sentiment comes through voice. And for you to understand the tone, the emotion, the feeling of patients or employees, voice can be, with proper privacy and proper data controls applied, can be a tremendous tool for simply understanding the emotive side of what's being said. Voice can also, for you, those of you who are marketers and planners and those who are thinking about how to reach disparate populations, voice can be used to identify characteristics. It can be used to identify my body mass, my relative height and weight, my age, where I'm from. My voice will reveal to those who study it very quickly that I grew up in the US Midwest, right near Chicago. The characteristics that can be used through artificial intelligence inference against data sets can also identify, when data is handled properly and anonymization is handled properly, can give you an idea of who your patients, your stakeholders, your employees are. Understanding comes from listening. And then finally, voice is a biomarker. Voice can provide leading indicators of a number of mental and physical illnesses. The list is increasing as researchers are pushing the edge of what can be done. And the fact that voice can be used in this way also makes it an increasingly important tool for remote patient management. It's not just telehealth, it's listening to the biomarker indicators in a voice, studying the voice prints, and then saying there may be an issue here. And there may be an issue that is growing and changing over time. The listening part of voice, critically important and of tremendous opportunities within health, wellness, and life sciences. Now, what's the future of voice and how is this all unfolding? How will a patient or an employee be able to connect with you? Let's say that at the start, they just want to reach a grocery store. Well, this is how it's going to work, and not in 50 years, not in 5 years, but in the next 2 to 3 years. First of all, there's going to be, for every enterprise, there's going to be a voice assistant. Enterprises will create their own voices. They'll have their own branded voice, and they'll be connecting and communicating with their constituents. In this case, let's say it's a grocery customer, and they'll do that through multiple ways. They'll be able to reach that voice assistant through a cellular phone. They'll be able to reach out through a voice-enabled World Wide Web. They'll connect through a general purpose voice assistant, perhaps like, say, Google Home, referenced here. There may be other alternatives of general purpose voice assistants. Those are emerging and coming into the marketplace, and they'll reach out to that grocer through their appliance or their automobile or their television set or wherever and whatever is voice enabled. which, as pointed out, is going to be almost an endless list of devices. Anything with artificial intelligence will be conversational. And once they reach that grocer, then they'll be able to also connect, because of the work we're doing in interoperability, system to system, agent to agent, assistant to assistant, be able to connect to all kinds of destinations, including their favorite hospital. What diet do I need to better improve my health outcomes? Where might I go on holiday? Can I afford it? What's in my bank? We move back and forth with different ideas. All of these organizations, from the grocer to the hospital, to the bank, to the transportation, will all have their voice assistants connecting and speaking with one another. This is the world we're moving to. This is the world the Open Voice Network is preparing us for. Now, why for health? What's the big deal? Why is this so valuable in health? Well, let's go back to the consumers. Let's go back to the actual patients for a moment. This is what they were interested in using voice for with their healthcare providers. Help me find a physician. Help me learn about a disease. Search for symptoms. Give me a place where 24/7, 365 on my time and quickly, without having to go through and be on hold or wait, I can gain trustworthy information about issues that are critical and central to my health. Please give me easy, quick, and very trustworthy information. That's what I'd love to have from my healthcare providers. But it goes beyond this. And again, and indeed, as we take a look at where value is created by voice within health, wellness, and life sciences, there's 5 general use cases. You may see more. You're the experts. We're learning about this. But from support services, again, 24/7, 365, trustworthy provision of information, as well as what are the visitation hours? What room is my family member in? Where do I go for information? Let alone symptomology. What about this? What about that? Voice enables hands-free clinical care. As we said, no more tap, no more type, no more swipe. And again, get away from grimy and dirty screens. Get away from grimy and dirty keyboards. If we're focused on as hygienic as we can be, voice gives us that opportunity. Voice as a transcription service and for task automation. Move to a place and a point by using voice technology where patients can read afterwards at their speed, at their pace, or even listen to a recording of what was said in the clinical room. So much is lost. I've learned, people have told me so much is lost when the patient walks away. Find a way to provide this information in an easily digestible manner across multiple languages to the patient. Also, cut the time, in preparing the charts and doing all the work of getting information into the healthcare systems. Use voice to automate, use voice to save time, use voice to be more accurate. I mentioned biomarker and sentiment analysis. Early leading indicators that lead to diagnosis of a number of physical and mental ailments, as well as understanding the sentiment, the emotions of patients, employees, and members of your stakeholder team, and then overall remote patient care and management. Continuous, not episodic, continuous care. Longitudinal studies using biomarkers, provision of reminders by voice, conversation for those who are lonely, companionship, and then a way to, again, reach out to underserved populations. These are all the things that voice can do. And when we take a look at what might be a patient journey, from patient awareness of a symptom, an ailment, a concern, to then the communication to the clinician, to assessment, to diagnosis, a treatment plan, treatment and management. And this is a circular thing, not linear, but shown here in linear fashion. Where do these use cases fit? Well, they fit in any number of places. The provision of information, the overall provision of hands-free, hygienic, in-clinic care, simply turning task management into that which is driven and task leadership into driven by voice. Transcription and automated tasks throughout, again, the patient journey, biomarker analysis, and then remote patient care. This is a technology, and you're the experts. This is a technology that we see from a patient perspective, as well as listening to you, the clinicians, and you, the experts. We see this technology as being tremendously valuable in a number of corners, in a number of areas of health, wellness, and life sciences provision. Better for patient outcomes, better for provider value. So now what? What do we do? Join us in exploring the value of voice. Talk to Harry. Meet with and connect with the other experts who'll be speaking with you today. There's a tremendous opportunity in health, wellness, and life sciences and voice, and we invite you to explore it. Explore it with us, explore it on your own, explore it throughout your communities. But this is coming your way. Your patients, your employees, your constituents want to be able to reach you, speak with you, and to hear you. Begin to explore the value of voice. Join us on our research. We're working on a paper right now on remote patient management, the value of voice in remote patient management from episodic to continuous care. Where and how are the opportunities? Where are the opportunities that you see that we may not? We'd love your contributions. We'd love your reviews. And finally, become a friend of the Open Voice Network. Talk to Harry. He'll tell you how to do it, but it shows your support of the work we're doing in developing standards, in exploring use cases, in respecting data, respecting privacy, and the overall ethical use of voice data. In the coming worldwide voice web, there'll be billions of voices connected to billions of digital destinations. You will want to reach everyone, and everyone will want to reach you. Everyone in this world of disinformation will want a trustworthy data and information source that should be and could be your brand. It could be your data, and it should be your voice. We're the Open Voice Network. We're dedicated to standards and usage guidelines for the emerging world of voice technology. Thank you.